Good afternoon or good evening, everyone, and thank you so much for joining us today in Justworks Ask an Expert series. Today's topic is picking health insurance plans, very relevant going into employer and employee plan selection at Justworks. A few details about today's webinar before we jump in. Your audio is muted by default so that we avoid any feedback. We've also received some questions upon registration, some excellent questions, which will be addressed at the end of the webinar. Finally, this webinar is being recorded and will be sent out by email to all registrants, along with details to register for upcoming webinars. Please note that this material has been prepared for informational purposes only and shall not be construed as legal or tax advice. With that, I'm Moses Ballion, Certified HR Consultant at Justworks and the moderator of today's conversation, with David Feinberg, VP of Risk and Insurance Programs at Justworks, as well as Don Amat, SVP, PEO Solutions Group at Aon Risk Solutions. Thank you, Don. David, would you care to begin?
Sure. Hi, David Feinberg, he, his, him. I've been with Justworks just over 5 years, and as my title implies, I've got responsibilities for the entirety of our insurance programs. The biggest one, and the one we're talking about today, is health insurance, but that also extends to things like workers' compensation insurance, as well as ancillary benefits like 401k, disability, life insurance, and all the way down to exciting things like perks like City Bike.
Fantastic. And Don, are you with us?
I'm here. Can you hear me?
I can hear you loud and clear. Thank you so much. Can you tell us a little bit about your role at Aon?
Excellent. Hi, everyone. My name is Dawn Amat. I'm a health and welfare consultant with Aon. I've actually been working with PEOs for over 20 years, and we've partnered with Justworks to help them manage their strategic benefit offering. So I'm happy to be here to discuss benefits, especially during this unprecedented environment.
Fantastic. Unprecedented indeed. Well, let's carry on. What we'll cover today is health insurance renewals as an opportunity, framing there, the cost of health insurance and its drivers, the health insurance landscape today, how to build a benefit strategy during these current times, as well as address pre-submitted questions at the end. So first, let's define the scope of our conversation. What do we mean when we talk about health benefits? David, I'll field this question to you to start.
So when we talk about health insurance at Justworks, I like to tie it back to our mission. Justworks' mission is to help entrepreneurs and businesses grow with confidence. So we do that by making it easier to run a business and help teams lead happy and healthy lives. And for those administrators on the call, we like to think about taking care of your team as giving them the resources they need to confidently take care of their physical, mental, and their financial wellness. And that also extends to their families, their dependents. And so access to high quality and competitively priced health insurance is one of the ways we deliver on that mission. But I would argue that more than just the health insurance, because you can buy that in many different places, it's the easy administration that we offer that makes it easier for you folks to run your business and for your employees to do their job. And then the last part I'd highlight is that we spend a lot of time curating services around health insurance, things like One Medical or Health Advocate, that should make it easier, again, for you as employers to make decisions about what to offer, as well as for your employees to navigate what is admittedly an incredibly complex system. So let's talk a little bit about renewals. Health insurance renewals are the same as if you were talking about any line of insurance. They occur once a year. And so when I think specifically about health insurance renewals, there are three primary stakeholders. So the first are the insurance carriers themselves. They think about the plans that they offer, what's covered, what's not covered, as well as the prices that they offer them at. The second is you folks on the call, it's the employers. And I'd argue that you have the toughest job. You got to balance the changes in coverage, what's going on with the health plans, as well as the price, and then look at your employees and what you need not only to retain, but also to make them feel safe. Our hope today is hopefully we can help simplify that decision-making process, or at least give you some things to think about as you go through that process. And the last stakeholder are employees. They're going to have this opportunity to change coverage to meet the needs of their lives, whether it be their own health, expected changes in health, things like the birth of the baby, or even try to make changes to consider their financial well-being.
Thank you so much for that, David. Don, I'd love to flip the conversation your way now as we talk about the realities of today's health insurance landscape.
Well, Moses, in the 20 years that I've been working with benefits, I've never seen the cost of benefits decrease. In fact, in the last 20 years, insurance premiums have actually gone up over 300%. It's the second largest expense that employers have. So managing this cost is definitely a priority for all businesses, especially small employers who typically don't have the bargaining power that a large employer has or that a PEO like Justworks has. But with that said, even a large organization like Justworks has to think about the cost management strategies to reduce increases, especially when they're nearly double the rate of inflation. So let's talk a little bit about what's driving some of those costs. So how are we spending our healthcare dollar? We definitely all want to know, I'm sure. So the drivers of medical cost increases are really related to how we as consumers utilize the benefits and the rate at which doctors and hospitals are compensated for those services that we actually seek. So then the insurance companies are basically left to balance out their profits while they're maintaining a focus on patient care. So if we think about the dollar, about 50% of it or 50 cents of it goes towards paying doctors and hospitals. So I'm trying to kind of think about an example that would kind of make that a little bit more real to us, because many of us on the phone might be thinking, I don't go to the doctor very often, so how's my 50 cents being spent? I was thinking about kind of the growing and aging population. So we are living longer, but the reality is that the older we get, the more benefits that we actually utilize. I was just reading a Kaiser study, and they were showing that half of the healthcare spent comes from individuals who are over the age of 55. So I want you to kind of keep that in mind as we keep talking through some of this, because that'll come back later on. Other things that we're seeing too that are driving some of these costs, we're definitely seeing increases in chronic illnesses like diabetes, obesity, depression, and the medications to treat some of those chronic diseases come with substantial costs. So I would say that the specialty and prescription drugs, those are also accounting for about 25% of the healthcare spend. So now we're up to 75%, and that remaining 25%, I would say 20 to 22% of it thereabouts are usually spent in taxes and administration and patient care. And we would say that the healthcare or health insurance profit is somewhere between 3 and 5%. But with all of these costs, the real question then starts to become, what is the insurance company doing to help manage those costs? And actually what we are seeing is that the insurance carriers tend to leverage managed care approaches to help them lower the cost. What does that mean for us as a consumer? So think about the days when we used to know just two different types of plans, maybe an HMO and a PPO. Now we have an acronym all over the place: HMOs, PPOs, POSs, EPOs, HDHPs. If we could figure out what all of those mean, that'd be half the battle. But really, there are ways for the insurance carriers to really manage how we access care and how much we're paying for that. Another way to think about some of the things that insurance carriers are starting to do and we're seeing or experiencing from a day-to-day perspective, I don't know about you guys, but when I drive outside of my house and I literally go down the road, I feel like there's an urgent care clinic on every corner. Urgent care is definitely another way that we're seeing insurance carriers try to innovate alignment with special pharmacies like CVS and things like that. Why? Because that costs less than you going to the hospital or accessing care that way. Think about the environment that we're living in today. There's been such a huge increase in telemedicine. That's another way that we're seeing the insurers try to find ways to manage the cost of care. But the reality is that a small percentage of the population still continues to account for a large portion of the healthcare spending. So why is that important? Our experience is that small and mid-sized clients tend to be very paternalistic and tend to build plan strategies geared at protecting their employees, which probably translates to picking the richest plans. But more often than not, the 80% of your population is not actually driving a lot of the costs in the plan. which means that they're typically overinsured or potentially overspending. So balancing your offering is key. And because you as the employer are also contributing to those very rich plans where those benefits aren't necessarily being used, those dollars could be redistributed to different types of offerings. Another interesting stat to kind of keep in mind as you're thinking about who's generating the claims is where the claims are actually being generated in terms of the network, in or out of network. The reality is that 90% of the utilization is actually in network. But whenever we typically see changes in our plan designs and assume that an out-of-network benefit has been taken care of or taken away, that it's negative, it's something to think about, because the reality is that less than 10% of users actually go out of network. The last reality that I'd like to talk about is that plan costs continue to shift to members. So we know that a key small business strategy to manage costs is to continue to increase deductibles, as you see here. In the last 5 years, we've actually seen deductibles rise over 40%. And the average small employer typically offers a deductible greater than $2,000. Another strategy we see small employers doing is shifting the cost to increase to the employees by potentially leaving contribution strategies flat and having the employees pick up more of the cost, or doing things like subsidizing the additional tiers like employee plus spouse or family tiers at a lesser rate than you're subsidized today, the employee only rate. So generally, the feeling is that you're paying more, but getting less. And one of the benefits of working with Justworks, however, is that you do have access to Fortune 500 benefits. And that means access to more product offerings and guidance to help you make more strategic decisions on how to build a portfolio this year. So essentially, these shifts don't need to be so drastic, as you're going to have more options. But you should have a good spread of offerings.
Dawn, thank you so much for your invaluable perspective and your deep knowledge. We talked a bit already about cost allocation. Let's open up the conversation to both of you and talk a little bit more about cost drivers.
So we know that healthcare trend is going up on average about 6.5%, and that's typically after employers make plan design changes. And we've definitely spent some time talking about the economic components that impact healthcare trends, things like price, how people utilize the benefits. The mix of your employees also matters in how things are priced, so their ages, whether they're women or men, and obviously plan design. But these items are going to typically be driven by changes in the economy, like a recession, like we're potentially experiencing today, regulations like ACA, or even other things like M&A activity in the insurance space, like consolidation of the carriers, or even a consolidation like we've seen between Aetna and CVS. So in terms of the opportunities to mitigate some of that impact, we don't often see small employers have the availability to impact those costs through some of the changes that you see here. So for example, focusing on wellness initiatives or adapting plan design changes, or even using navigation type strategies and optimizing provider network. Instead, it's really left to small employers to kind of focus on things like managing utilization. But this is where Justworks as a large group benefit offering really helps the small employer. So David is going to talk about some of the strategies that you might want to consider employing this year. But before he does, we probably need to talk about the elephant in the room, and that's COVID-19. So when this year started, I would say that probably nobody was thinking about COVID-19 or how it would turn everything upside down. I literally get asked on a daily basis what the impact of COVID-19 is going to be on renewals. But the truth is, we really don't know the answer yet. The economic slowdown that's occurring has similar patterns to the recession of 2008, 2009. We definitely see utilization changing and slowing down. But it is slightly different still. We're seeing things like furloughs go into place versus direct layoffs. And although we may eventually get to a place where we might see some of those direct layoffs, we actually haven't started to see tremendous impacts on things like COBRA. So less participation in benefits is something that we're seeing, and we know that that does typically impact loss ratios, especially if the individuals who are staying within the plan are the ones that are utilizing the plan and they need benefits. We also know that there's virus costs coming. There are going to be costs associated with vaccinations. There's definitely increased hospitalizations in certain hotspots across the country, but we don't really know yet what's essentially going to happen. But what we do know is that we have what I'd like to call an upcoming healthcare bubble.
So
why do
that's
we
one thing
that?
I know as a consumer of healthcare is that healthcare inflation is outpacing real inflation. So I'd love to hear more about that.
Yeah, this is an interesting little study done by McKinsey where they reached out to some folks and they asked them how many of them were deferring healthcare, and when things got, quote unquote, back to normal, how many of them would actually resume healthcare. So if you look, the reality is that we know that there are people deferring healthcare. If you look at the left side of this graph, we all know someone, myself included, who's likely put off going to the dentist or even a routine checkup during this time, right? And these we know are going to pick up again. But as we've learned over the last few slides, these are not the areas that are really driving healthcare costs. It's really the right side of the graph that we need to worry about. The needed services that people have put off that are going to ultimately drive claims because people may not be getting the care that they need right now. So we could actually see some worsening health conditions that are going to drive more activities. So remember, 20% drive 80% of the claims. This is the 20% that we need to worry about, that right side of the graph. In the middle, if we assume, that these are really more of the elective type surgeries and activities that are happening, this is where we have seen a significant amount of deferred utilization across the whole portfolio in benefits, and the carriers have experienced this as well. If we use 2008, 2009 as kind of a benchmark, we can estimate that after that recession, about 40 to 50% of the deferred utilization actually did come back. So if you don't mind changing to the next slide, what I would say is if you ask me today what the impact is on renewals, we could tell you that we know that there's less utilization of the plan today because people are quarantined, they're staying home, they're afraid to go out. We know that people are accessing healthcare in a different way, like telemedicine, so ways that hopefully are going to drive some of the costs down in plans. But on the other side of that, we also know that we're seeing less membership. People are dropping out of the plan because of cost, and membership equates to premium, and premium is used to cover the claims. So less membership is definitely concerning. And then we have the unknown with the vaccinations. There's going to be a cost associated with the vaccinations, but today we don't know what that cost is. I think there's one last issue that we probably need to think about, and that is that there's a reality that there's other unknowns, the health and wellness issues that come from just being home for long periods of time and some of the economic challenges I think that people are going through today. So unfortunately, it's still a little too early to tell what's going to happen in 2021, but we know something is going to happen.
Absolutely. And the parallels, I'm sure they're very valuable insights to draw from 08, 09 and healthcare consumer behavior during the last recession. Without question, this time around, it's different because the reason people might be deferring care or elective care would be fear of exposure rather than just purely economic motivators. So with all this in mind, and the unprecedented circumstances, 2021 having a lot of unknowns, how should small businesses think of their benefit strategy right now?
Thanks, Moses. So one of the challenges we see that all businesses have is assigning value to the benefits programs. And what's ironic is, as Dawn highlighted earlier, after cash compensation, benefits programs are the second biggest expense to employers. But as we've all experienced, when you're employing people, really you get a variety of experiences. Some people the first question is, what's your benefits package? Some people, they don't even know what it is until an enrollment packet lands on their desk. And so what I look at this chart, I like to think of this as BC or before COVID. I would like to think that the chart changes a little bit, but what you see is that based on your generation, you're going to rank the value of a benefits program very differently. So if I'm an employer, the reality of that value comes in two buckets. First is monetary, as we just covered. Benefits are your second biggest expense. One of the nice things about the Affordable Care Act is now we are required to report the employer portion of a premium contribution on your W-2. So hopefully your employees begin to appreciate that in addition to the cash compensation, the amount of money that you're putting towards their benefit. But the second is peace of mind. And that applies to all insurances. I have this conversation every day. Every day I go out in the world, I use my health insurance. And the reason is because I have the peace of mind that if I get sick, if I need to pick up drugs, whatever, or same goes for my family, that it's there. And that's what insurance is there for. It's not necessarily when you go to the doctor, it's there every day just in case. And I believe that now that we're in the midst of a global pandemic, more people, regardless of their generation, will begin to understand that. They should have peace of mind that God forbid something happens, they will have that coverage in place to go take care of them. But the last takeaway I would have is even ignoring COVID, what employers need to think about is having a variety of plans that meet the needs of different generations within their workforce. People, as Dawn highlighted, you have your 80-20 rule, you have different generations, you have different people in terms of dependence. And when you're putting together plan designs that you're going to offer, you have to think about your current employees as well as those that you're going to enroll over the coming year, and making sure that you have a sufficient variety of plan designs to meet their needs. One size clearly does not fit all when thinking about a generation. And the advantage, again, of working with Justworks is we offer dozens of plan designs to help you meet those needs.
Thank you, David.
Okay, so we've discussed the reality that healthcare costs are definitely outpacing wage increases. Employees don't actually have much left in their paychecks for anything else, like student debt or 401k contributions. But as we think about this affordability challenge, it's very real, especially in these economic times. So as a small business employer, it's really important for you to understand what your employees value, as David just highlighted, and how to access the Fortune 500 benefits for your employees is invaluable to your strategy. So please bring those into play, because if your organization is in a financial place this year where you have no choice but to lean out your plan offerings, there are different ways to use voluntary benefits to complement that change. And that can mitigate the impact to an employee, and sometimes for very, very little cost. In terms of cost, I think we can continue to see trends in claimants that exceed $1 million. They're higher than they've ever been, the number of $1 million claimants. But understandably, not all of those things are controllable to you as an employer. But the role you can play, as David highlighted earlier, is to continue to really help your employees to become informed users of their health care. Understand what benefits you're being offered through Justworks, what the carrier is offering, and how to utilize and access those benefits. The challenge is big, so I'm going to hand it over to David to help you understand the trends we're seeing in the Justworks plan and show you ways you can take action.
Thanks, Dawn. As you've heard time and time again from me, and it'll be a continuing theme, I think now it's more critical than ever for employers to maintain their health insurance. That said, there's this reality that we're facing a recession. And so how do you balance those two things? Well, I want to highlight 4 levers that are the most common when you're about to go through renewals or picking plans that you should think about. The first 2 are related. It's premium matching or premium contribution and plan designs. If you've ever purchased a health insurance plan, those are the first 2 things you need to think about. How much premium am I going to put towards my employees, and what plans to offer? And those are things you should be considering every year. When I get together with Dawn and we look at a lot of data, one of the first things that stands out to me about Justworks employers is we offer some really rich benefits. I would argue we're overinsured. Many of you on the phone contribute 100% of premiums. You're offering $0 deductible programs, and you're offering out-of-network coverage. Let's start with the $0 deductible plans. They largely eliminate cost sharing, especially for expensive procedures. If you go back to Dawn's slide that had the dollar, 2/3 of the typical healthcare spend goes to prescription drugs and doctors and visits and services. I then have the benefit of looking at Justworks membership, and we are above average when you look at primary care, specialty care, and lab visits. And then when you look at high expensive things like emergency room visits and inpatient stays, we under-index against them. So why are you paying for $0 deductible plans that are paying for insurances that on average your folks aren't using? I would focus on making sure that the plans you have copays that have access to primary care and prescription drugs. And then a corollary to that is out-of-network benefits. As Dawn talked about, no more than 10% of claims are out-of-network benefits. And in order to get that coverage, you pay a premium. And when you actually, for those of you who've actually filed an out-of-network claim, first of all, the deductibles are typically astronomical. And if they're not, the carriers have cutbacks so that you don't get a dollar for dollar return. So if I'm looking at places to cut, those are the first two. The second goes a little bit against what Dawn said, but if you're in a budgetary constraint, look at your discretionary benefits. Right now, health insurance, it's paramount to offer. Many of you include dental, vision, other things like life and disability. They are important. As a matter of fact, I manage those products as well. But if I had to rank order right now, I would be putting health above all else. The last, for those of you who spend time with me, is a personal passion. It's high deductible health plans and HSA products. These are not easy to understand, and the industry as a whole has struggled for years to get folks to believe this. But I focus on a few things when highlighting. The first is the access to HSAs. Your employees cannot access these health savings accounts, without enrolling in a qualified high deductible health plan. So why do HSAs matter? Well, they're pre-tax contributions akin to a 401k. And like a 401k, if you have excess money, you can invest it. When you leave your employer, you take that money and you can utilize those monies as you modify for your life. Imagine an individual who's single, they could be contributing as they build a family or have other life events, they can then spend those monies towards those family members. So it is very much like a 401k specific for health insurance. Now's my warning. If you're going to make this switch, you as an administrator have to spend a lot of time understanding it. They are jarring. They're important. I've made the switch in my own life, but I have seen time and time again, and I'm sure Moses has, folks who they see the high deductible, they see the low premium, they elect that plan in August. Come November 2nd, when somebody goes to the doctor and the plan behaves very differently, we get calls saying, I don't know what I bought. The last point I'd make, which I'm a little reticent to make, but I do think it important knowing our membership, high deductible health plans are also a good options for high earners. We talked about HSAs as a pre-tax benefit for those investing in the future. The same applies to those that are trying to shield or reduce their taxable income. I'll leave it there.
Great, David. I certainly share your enthusiasm for
For those that have been stuck with me, we talk about it quite a bit. I get made fun of. Let's talk about being a better consumer of your health plan. If you haven't figured out by now, you will. I'm a little bit of a car buff, so I think about health insurance alongside car insurance. And so what I find is that many people buy their health insurance as if they would buy a car. They focus on deductibles and copays. And to me, that's like going into a dealer and saying, well, how fast does the car go and how quickly can it break? Those are clearly important, but it's also important to know, like, do you have anti-lock brakes on that car? Are there backup cameras? Is there lane departure warning? You're going to ask those questions, but very few people ask it about their health insurance. So first, I highlight that working with Justworks, I'm proud of the team. We've put together a suite of services that makes that health insurance work better for you. We've got One Medical, we've got Health Advocate, but also don't discount the carriers. Aetna, Kaiser, United, all the folks we work with have their own programs. They have insight into how things work. I would tell you and your employees, if the carrier is reaching out to you to help you, particularly the nurses, there's a good reason why. The second thing that I would highlight is a recurring theme. It's this concept of in-network versus out-of-network benefits. It took me a little while myself to come to this appreciation, but if you can move your services in-network, it's going to be lower price and typically also better quality. The carriers invest a lot in their providers, in their facilities, in evaluating them, and in getting you the best spend. The next, this is my biggest pet peeve. We look at our claims data and we index as a population, as JustWorks population, against preventative screenings. It makes no sense to me why people are not going and getting these procedures year in and year out. And actually, I'm going to highlight for those women on this phone call who are eligible for annual mammograms, that's the one area where we under index, and it drives me nuts. This is one of the easiest ways to get a handle on your health and to identify some potentially, Dawn was talking about $1 million claims or large claimants. You can identify those early. Please, please, please go out there. I will leave it that I won't limit it just to the women. It's kids, it's men, it's all of the healthy visits. And the last thing I would talk about that I think is the most important now is behavioral health. A few things are going on. In my mind, the current environment is the combination of the trauma from September 11th, the medical fears of SARS Part 1, and the economic crisis from 2008, all in one. So what are folks doing? They're sitting at home. And unfortunately, that means they're drinking more and potentially they are abusing drugs. So we've already seen in our data, with the data that's pre-COVID, that our population has a prevalence of anxiety. And I'll tell you that 5 of the top 7 drugs that our folks are consuming today are geared towards depression and anxiety. So that's before March. Now you layer on everything that's going on, and I'm concerned that we're going to have an additional mental health crisis focused on substance abuse and alcoholism. So when I see that our members have access to behavioral health via telehealth, please get the word out that that resource is available to you and your employees.
Thank you so much, David. I think that's a really relatable anecdote as far as some of the struggles we might anticipate, and definitely some food for thought for our informed consumers of health insurance on this webinar today. I'm so excited to get into our Q&A, which contains questions submitted by real attendees upon registration. But first, a few housekeeping items in summary. So first of all, look for the follow-up email to this webinar. It's been recorded. We'll be sending it out after this. Share it with your colleagues. If anyone wasn't able to attend live today, they'll be able to view this down the road. Second, join us for a special renewals edition of the Ask an Expert webinar series on August 5th, where we'll examine the state of health insurance, how to pick health insurance plans in light of COVID-19 and economic uncertainty, and also to see what's new in the Justworks platform this year. Again, that's on August 5th, and the link to sign up will be contained in the follow-up email to this webinar. You can also access your 2020-21 Health Insurance Renewals Guide, where you'll learn more about the national health insurance landscape, see what factors into your rate at a high level, and also get guidance on how to pick the right plans or contributions to meet your strategic priorities. Last, customers on this webinar should book one-on-one time with your account manager or a representative of our customer support team, where you can ask us anything about going through the renewal process, managing open enrollment for your team, or to better understand your renewal rate. We can't tell you what to pick, but we can sure help inform your decision-making. Lastly, for attendees who are yet to be Justworks customers, to learn more, please contact experts at justworks.com, and we would love to chat more with you. With that, David and Dawn, thank you so much for the wealth of expertise. Let's dive in. Our first question, I'm looking at renewals, and before I keep the same plans, do plans change year to year?
So yes, plans change. Every year, as I mentioned, there were 3 stakeholders. The carriers are looking at what's covered and they make adjustments. We will offer all the same, we're not sunsetting any plans. So, if you have a plan, you will see a plan. If anything, you'll see additional plan options this year. But it is important, even selecting the same plan year over year, copays are going to shift. Some of the cost sharing elements are going to shift. They will look and they'll be named the same thing. We're going to do our best job through the renewals process to highlight what those changes are so you can be informed as well as tell your employees. But I do encourage you, many of you do continue to elect the same plan designs and contribution schemes. Just take a pause when you go through the renewal flow and keep an eye on what those changes are, just so the first time you get a question from an employee, you know what to expect.
Great. Thank you, David. Our next question is about mandates. So this sounds like a very informed attendee, what mandates are covered in your plans, and what is a mandate in this context, David?
Oh, so mandates are coverages that are, as they sound, mandated by a government. More typically, it's the federal government or state government. Many people are familiar with the mandated coverage that came into effect following the Affordable Care Act. That continues to stay in place. And there have been some tweaks, but usually when we're talking about mandates, people are focused at the state level, and those typically change year to year. This year, the things that I would highlight, the biggest changes, are for all of our Aetna plans. For those of you enrolled with Aetna, we will have two mandates come into place. A specific, so even though they're New York State mandates, they will apply to all of our Aetna enrollees. So the first is around in vitro fertilization coverage, IVF. So all plans as of November 1st will include that mandate and cover. And the second is around Truvada or PrEP, which is access to medication that's designed to prevent the spread of HIV. So both of those coverages under the New York State mandates will be included in our Aetna plans.
Fantastic. And for clarification, that will be for covered employees in New York or everywhere?
Sorry, thank you. It will be for all covered employees enrolled in an Aetna plan, regardless of where you are. We do work with Kaiser and United in some markets. Those mandates do not apply to those carriers in those markets.
Great. So a New York mandate is changing the landscape for Aetna enrollees everywhere. Thank you. Our next question is, as an administrator going through plan selection, what do I need to be thinking about this year in particular? Well, we definitely started that conversation on this webinar today, but maybe if you just care to rehash anything or summarize or give us a few bullets here.
Yeah, I hopefully we helped inform this question by focusing on the first thing. First, it's variety. You got to think about the generations of your employees, what they will cost. Also, one thing we didn't talk about, but it's important, is to think, for those of you on the call that might be worried about layoffs or furloughs, you need to think about low-cost options for those employees who might need to enroll in COBRA. If all you're offering is very rich plans, should those individuals unfortunately come off the plan and have to enroll in COBRA, they will only see very high-cost plan designs. So you want to think about your current employees, you want to think about potentially laid-off employees, so it's variety. The second is this concept of overinsurance. As is often the case, we assume more expensive is better and more coverage is better. But what we need to think about is truly how people are utilizing the plan, and what Dawn was highlighting in terms of the 80-20 rule. I would agree. Many of our, when dealing with small businesses, they tend to be paternalistic. They want to take care of everyone the same way. I'd argue that that's really challenging right now. And so all of us are going to have to make some difficult decisions, but I would say paramount above is to maintain the plan. And the third is my car insurance example. You and your employees, I would really encourage you to invest in understanding all the parts of that health insurance so you're fully utilizing that, whether it be preventative screenings, visiting a One Medical, utilizing Health Advocate as a resource. They are really important parts of your health plan that we typically see folks underutilize.
Great. Wealth of knowledge and recommendations, David. Thank you. Last question. How do I get data about company contribution levels, employer contributions to premiums, so that I can benchmark? Does Justworks have resources to help me as the benefits administrator navigate this? Why, yes, I'm so glad that you asked. So for customers, we will be sending out our renewals guide in the follow-up email to this webinar. Those of you attending, yes, we do know who is a customer and who is not. So customers will be receiving this guide where there is benchmarking, comparative rates, where you can just get a better sense of where you're at, of what is on the market, maybe what the talent you're seeking, what they might be getting elsewhere, as well as we have the webinar on August 5th, where you can attend and learn more about what's new with Justworks, and also more in depth onto how to strategically pick plans. Again, that opportunity is going out for customers. Any non-customers on the call, I hope we got you really excited about Justworks' offerings and the way we support our customers. And so please email experts@justworks.com to learn more, and we'd love to chat with you. So with that, I just want to thank everyone for coming today, for becoming more educated consumers of healthcare, both as individuals and as employers. And more than anything, David and Dawn, thank you so much for the generosity of your time and expertise today.